And I'm Dr. Parker, and I'm going to introduce our presenter today. Our presenter today is Dr. Joe Nocera. By profession, he is what we call a kinesiologist. That's a person who studies movement and exercise, and his research is focused on the connection between physical activity and cognitive function. His research is extending into the effects of cancer and cancer-related activities and how that affects the brain and cognition. So exercise, diet, pollution, socioeconomic status are part of what they call now the exposome. That are the external factors that may play a role in how somebody develops or doesn't develop Alzheimer's and related dementias. So Dr. Nocera is going to talk to us about exercise, which is part of that exposome. And that's the thing over which we have most control that allows us to determine whether or not we become victims of Alzheimer's or related dementia. Dr. Nocera.
Thank you, Dr. Parker. I'm going to share my slides here. And hopefully we're seeing that correctly. We're really excited to be here this morning. This afternoon. I think all of our meetings should start like that with a round of exercise. That was great. Again, I'm really excited to be here today. I was looking through the names of people, certainly some folks I recognize from being out and about in the community, interacting with you also. Very excited to be here and talk with you about exercise for brain health and aging. I'm Joe Nocera, Associate Professor, Emory, and Executive Director of the Center for Visual and Neurocognitive Rehabilitation at the Atlanta VA. So I do like to start these talks with kind of highlighting some misconceptions that are out there about exercise. I think this is important because it kind of educates us on where we're at and what we're doing as a society when it comes to exercise. So, one of the first things that we hear quite a bit of is, well, what's the point of talking about how good exercise is for us if nobody does it? Well, that's actually really not true. So if you look at this data here from the CDC, these are old adults over the age of 50. And you can see it says approximately 1 in 4 adults age 50 and over are inactive, right? So I like to look at the glass half full. That means that 75% of people are active that are over the age of 50, and that's great. Now that number does decline, meaning more people get inactive as you introduce chronic disease. But the fact is many people are exercising, and that's a great thing. What we need to do is learn from those individuals. We need to understand what they are doing, what they enjoy doing, why they stick with this activity, because it's so important for our overall health. As you can see on the bottom there, inactivity puts 31 million people at risk of heart disease, diabetes, cancers. Obviously, all these impact our brain health. So very relevant to what we'll be talking about today. All right. So when we talk about a misconception that people don't exercise, well, most people don't like exercise, so nobody does it. This is data from an app called Mappiness. So very simple. You have your smartphone, you download this app, and just very randomly, any time of the day or night, it'll send you a message. How happy are you right now? 1, you're not happy at all. 10, you're very happy. And then the next thing it says, well, what are you doing? So when I'm in a large crowd like this in person, I usually pause for a second so everybody can kind of giggle at number 1. But if you look at number 2, sports, running, and exercise. So these are things that people absolutely enjoy doing, and they rank very high. And you see number 3 on there is dance. Dance is also a form of activity. So people certainly enjoy exercising, and the data supports that. I believe at last count there's 300,000 people across the world that are using this Mappiness app and ranking exercise is very high in terms of things that they enjoy. So again, it provides an opportunity for us to understand what is it about exercise, what types of exercise are people enjoying, again, with the goal of increasing that number of those that are active to even higher, above 75%. Oops. All right, and there's also, what's interesting is that there's been work out there when it comes to people don't exercise to show that if doctors actually prescribe exercise to people, that they'll increase their activity levels. So this is just an example from a couple different types of, you see cancer survivors as an example, but there is data out there to support that if healthcare professionals prescribe exercise, just like they would prescribe a drug, for example, individuals will increase their level of activity. And that's pretty exciting. I'm going to talk about one example of that that's been very successful called GeroFit in the VA system. All right, here's another misconception. Oftentimes we hear, exercise, it's not safe. I'm not sure I should be doing it. I'm worried that I'll hurt myself or I'll have a cardiac event, maybe a heart attack. And honestly, I can't necessarily blame some people if you're somebody that hasn't had physical education since maybe high school. That could be decades ago. And then you go to a gym, and this is just a picture I took off the door at my gym. And it says, by entering into this gym, you accept that training or exercise at this gym may be dangerous and could result in your injury or death. That's not very inviting. I joke that if you go home or if you're at home now and you start flipping over your couch cushions, there's no label on your couch that says that sitting here for a long period of time can result in your injury or death. But sedentary lifestyle does lead to more deaths than exercise. All right, misconception. Another one is that, why are we, from my work, why are we studying exercise if we already know everything is good? So this is a very complicated slide, but you can see from the kind of the neck down of these two cartoons, there's all these different pathways, and all these are showing that these are beneficial effects of exercise. And again, from the neck down, but when we look at the neck up, where those red boxes are, it says things like neuroplasticity and neurogenesis, and those are certainly very, very important things. But what it doesn't highlight is why exercise is so good for the brain. So we have quite a few studies going on where we're trying to understand what is it about exercise. And this understanding the why is really important because it'll help one target exercise to people that could be most impacted, but it could also assist in therapeutics or maybe combining exercise with other therapeutics as well. So on the other side of the coin, we talked about sedentary. So how bad is inactivity? Well, it's really, really bad. So we know exercise is really good. This is from a study that was just looking at your highest risk factor of doing certain activities. And you can see smoking. We all know how bad smoking is for you. And your risk factor to have adverse health events is 1.5. And that number is not important. It's just that there's a very high risk factor profile that comes along with smoking. As you can see, physical inactivity is right below that. We also know how detrimental it is for your health to have a high BMI or a body mass index, and you can see that physical activity is above that in terms of the risk profile. So the higher the number, the greater the risk. You can see high blood pressure, high cholesterol, diabetes. So 250,000 premature deaths in the U.S. every year are directly attributed to physical inactivity. So that's an area we can really be impactful. And then what's even more beneficial and exciting is that exercise is a treatment for many of the things listed there. So high blood pressure, high cholesterol, diabetes, exercise would be a first line defense for some of those things. And again, all these are tied to brain health, which is very, very important in the context of this talk. So mortality. So this is data showing the relationship between sitting, so time spent sitting, and mortality. So this is over 17,000 people across a very large age range. You could see the follow-up was 12 years. So a lot of people tracked for a long time. Of all of those people, there were over 1,800 deaths. Many of those were from cardiovascular disease or CVD, so cardiovascular disease. Many were from cancer. And what you can see is those that sat the most, there were associated with increased all-cause mortality and cardiovascular disease. So again, sitting, not being physically active, not getting up and moving around, is the highest associated with all-cause mortality and cardiovascular risk. And importantly, there's also studies reveal a strong connection between heart and brain health. So when we talk about increased risk of cardiovascular disease, that's also going to increase your risk of negative brain health outcomes. So here's some data specifically looking at brain health. So this is looking at the onset delay of dementia. So what I'm showing here, and I don't know if you can see my cursor, but the darker line of these two is the lower line. These are the individuals that exercised more than 3 times per week. And you can see that their incidence of dementia started at about age 80. Those individuals that were more sedentary, that exercised less than those, their incidence of dementia started about age 72. So that's an 8-year difference. So, and those exercising more than 3 times a week are more likely to be dementia-free as they age, and that's up to 8 years. So more exercise, less dementia risk. Really exciting data. But what about when we look at the size of the brain and exercise? So this is data from quite a while ago now, about 20 years ago, from Stan Colcom. What we're showing here is two parts of the brain, both white matter and gray matter. And these areas that are lit up are sort of this fire color, whether you're talking about white matter or gray matter. These are areas of the brain that atrophy as we age. And this is not surprising. This naturally happens, just like our muscles tend to atrophy as we age, the brain does as well. Now, what's interesting is these two figures that are coming up, when you look at people that have been in regular exercise programs for most, in this case, it was over the span of their life when they were surveyed, these are areas of the brains that were spared, so had less atrophy based on those that exercised the most. So as you can see, they pretty much line right up on top of one another. So those areas that are susceptible to aging and atrophy are less susceptible to aging and atrophy as you exercise throughout the lifespan. So there's been some other studies. Art Kramer, this probably one of the most seminal works in 1999, showed that aerobic training showed substantial improvements in performance on tasks requiring executive functions. So what are executive functions? These are tasks that allow you to take in information, update that information, and then use that information correctly. So think about, you wake up in the morning, you get dressed, you walk out to the kitchen, you have your coffee, you're kind of taking in information, you're updating, and you're doing the next step throughout a task. Really, really important, and also very susceptible to aging. So really exciting that you could take somebody that's older, aerobically train them, and then they would improve on these tasks. In 2006, Stan Colcom followed up on his earlier study where he showed that the brain shrinks in those that are more sedentary, showed that you can actually increase the volume of the brain following a 12-month fitness program. So the question is, how is this happening? Why is it that the brain looks and appears more healthy in those that are exercising versus those that are not? And so this figure here is my work and my lab's work over the last going on over 15 years now. And so put these in kind of different boxes. These are long-term studies, but I'll just kind of summarize. So the first blue box, what we can do is we can put somebody in the scanner and have them do in a brain scanner and have them do various tasks. We can have them do cognitive tasks, so thinking tasks or memory tasks, or we can have them do a task where they're moving their feet or their hands, and we can look at how the brain behaves, how it kind of lights up in certain areas during this task. And what we've shown, whether you're talking about a motor task, so moving your body, or a cognitive task, is that the brain behaves healthier. It works more efficiently following 12 weeks of exercise in older adults that were previously sedentary. So pretty exciting. We can take older adults that were previously sedentary, run them through the brain scanner on these very specific tasks, look at how their brain behaves, and then 12 weeks later do the exact same thing. And after that exercise, the brain behaves the way the metabolism of the brain actually is more efficient and better. A lot of this has to do what's in the red box, the next panel there. So in the red box, we're looking at different neurotransmitters throughout the brain, and these are important for how the brain processes and works. And so what you can see is that we show that, again, both before and after exercise, we show that the level of these neurotransmitters and how these neurotransmitters behave is more efficient following exercise. What's really exciting about this work is that we've also started to do this in individuals that have had a stroke, and we're showing a similar profile in that we can change the level of certain neurotransmitters that improve the way the brain behaves. The black panel, the first one on the bottom there, this is where we are able to look at the small vessels of the brain and how they constrict and how they dilate in the face of demand. So we have these very small blood vessels throughout our entire brain that, as we age, aren't as healthy as they once were. And what we show with this technique is that we can actually improve the health of the vessels, again, following 12 weeks of exercise, which is really exciting. The green panel there, this is looking at a certain amount of blood flow, so the amount of total blood flow that goes through the brain in older adults that were physically active versus younger adults. And as you can see, there's no difference there. So older adults that are physically active roughly have the similar amounts of brain perfusion, or the amount of total blood that's going into their brain. And all this work collectively simply means that the exercise is causing the brain to work more efficiently. It's in a state that's more healthy, and what we believe a state that lessens the risk of neurologic disease. So, like I said, that was about 15 years worth of science that I showed in one slide there. But I typically in a talk like this, I always get the question, well, what exercise am I supposed to be doing? I believe you, Dr. Nocera, that exercise is good, but what am I supposed to be doing? What exactly will give me the results that you've shown in your studies? And my response to that is always the same. It's always the one that you enjoy. So we talked about very early on in this talk that 75% of people over the age of 50 are active, and I can assure you that the reason they're active is because they're enjoying what they're doing. They've found probably multiple different types of exercise that they enjoy. Perhaps they've found groups that they enjoy exercising with, and in addition to that, they've also made it a part of their lifestyle. So perhaps they park the car a little bit further from the grocery store to get extra steps in. Take the stairs instead of elevators. So just not only ways to do very structured formal exercise, but also ways to just increase your physical activity throughout the day. And if you're doing that, you're lessening the time you're sitting. And we showed data on why sitting is so detrimental. So the exercise that is best for you is the exercise that you enjoy. So the great thing is we have a lot of options out there. This time of year, maybe not so much outside. It's getting pretty hot, but there are numerous different types of exercise, and you really should try different things and experiment with not only different people, but different types, and see what you can really find and be passionate about. In terms of once you identify an exercise, what should you be doing? How much? So these are data from health.gov, the American Heart Association, that's AHA, and the American College of Sports Medicine, that's ACSM. And so they all have basically the same guidelines. So what they say is you need to be doing 150 minutes each week of moderate intense aerobic activity. So these are, if you're outside, you could be walking, for example. If you're at a gym, you could be on the treadmill, you could be on the stair climber, but you want to, over the course of a week, you want to get 150 minutes of this moderate intense. So typically they consider that moderate intense about, you can hold a conversation with somebody while you're doing it. You also get a heart rate monitor, so you know a little bit better, but roughly moderate intense activity allows you to have a conversation while you're doing it. Or if you don't have 150 minutes a week and you need to get a little more efficient with your time, you could do just 75 minutes a week, but that's going to be more vigorous. So think of jogging, being on a treadmill that really you're either walking very fast or at a jogging pace. And this would be a little more difficult to have a conversation with somebody because you'd be breathing heavy. Now, in addition to that, it's really, really important. We talked about brain shrinking or atrophying as a result of age. Well, muscles do the same thing as we mentioned. It's very important that you do muscle strengthening exercises on major muscle groups 2 or more days per week. And then because of fall risk, that's very prevalent in populations as they age, there's also a need to do exercises that maintain or improve balance. So balance exercise. What's important about these is there's oftentimes you could be doing muscle strengthening exercises. Think about lunges or squats that would also be considered a moderate form of physical activity, physical aerobic activity, similar with balance. So there's a lot of overlap in these. But in general, these are the guidelines that are provided by National Institute of Health and these other organizations listed. Excuse me. So here's some of our evidence-based exercises that we've done. Aerobic exercise, I mentioned that a couple times in the talk. So there's spin cycling. This would be on a bicycle. We've done a lot of that in our lab. Walking, jogging. For strength training, there's programs like Ageless Grace. There's some online. There's been a really big jump in some online programs that are done virtually for convenience. There's a program called Vivo. For balance, there's Go for Life. That's done through the NIH. Tai Chi is also a very popular balance activity. And then flexibility, something like yoga you could do. So each example, like I mentioned, has benefits to improve your functional profile: heart, brain health, muscle strength, mobility, flexibility, and balance. So there's a lot of overlap when you talk about spin cycling, for example, that's aerobic exercise activity, but we'll also be strengthening our leg muscles, which is really critical. So now I've begun to talk with highlighting some misconceptions that individuals don't exercise, but there are 75% that do. And in my belief, the reason that individuals are with the highest activity levels is because they have the opportunities to do that. Either they have a place, they also have the resources and the knowledge to implement a program that's successful. But we are lacking the support for healthcare professionals to really successfully prescribe exercise. So if you think that it's not uncommon where you may go to a healthcare professional that says, okay, you need to exercise. And that's the end of the conversation. You're not really exactly sure what that means. But imagine if that was more prescribed, scripted, work with this exercise trainer. That would be really, really, really helpful. One way we can do this is by establishing programs that are shown to be both beneficial in terms of health, but also cost effective. So fortunate enough to be a part of a very large trial that finished just about a year or two ago, called the EXERT trial. So this was a clinical trial to test whether physical exercise could slow the progression of mild memory loss or mild cognitive impairment in adults between the ages of 65 and 89. You can see the red dots are where this study took place throughout the United States. Numerous sites were part of this, and it came up to nearly 300 male females aged 65 to 89. And these were individuals that were diagnosed with mild cognitive impairment, were enrolled in this program to see if we could slow the progression. So I will start by saying that this study was about 2.5, 3 years in when COVID happened. You can also see where those red dots were on the previous slide. It was a lot of different states. There was a lot of variability in how these individuals could continue being in the study. This study took place at YMCA's, that's where the exercise took place. So some of those in some states closed, some stayed open. But needless to say, it made for a very difficult controlled study. However, there was some exciting findings. So there was over 31,000 exercise sessions were completed during the first 12 months. Now, what's exciting about that is we alluded earlier to talking about if we give people the opportunity. You have somebody that's been previously sedentary for quite some time. They've been recently diagnosed with a neurologic disease, and you give them the opportunity, and you can see that a lot of them completed their exercise. So 81% attended all their sessions, and the aerobic exercise group, and then there was a stretch and balance group where they attended at a clip of about almost 90%. 60% of those participants reported continued exercise through the pandemic. So again, that made it very difficult when you introduced COVID throughout this, but there was still adherence to the program, which was exciting. Now, what did the data show? So what happened with cognitive health? So neither one of these groups, you have two different exercise groups, the aerobic group and the stretch and balance group. Neither group showed a 12-month decline on the rating scale for mild cognitive impairment. I have the abbreviations there, but what's important is that this is just a rating scale. When you're diagnosed, they rate you and you're assigned a certain number on your cognitive status. So of these two exercise groups, neither one showed a decline. Why that's important is because there was a non-exercising comparator cohort. So this was a group of participants that had MCI, but they weren't exercising. And when we compared those that exercised to those that didn't, those that did not exercise showed a decline, an expected decline over the course of 12 months. So exercising groups kind of maintained the cognitive status they had, whereas those that remained sedentary declined over 12 months. So that can be, a pretty exciting finding when you talk about delaying the progression of a neurologic disease. So another program that I want to talk about where, again, we're trying to highlight opportunities to increase physical fitness in individuals. This is a program that's been extremely successful in the VA system. It's called GeroFit. So it's an exercise program that promotes health and wellness for veterans. Veterans are given personal exercise program based on their physical function profiles and goals. So this is a program that is very simple. If you are a veteran and you see your healthcare provider at the VA, they can write you, a script essentially sign you up for GeroFit, and then you're in the program. And it's not a 12-week program. It's not a 6-month program. It's not a 1-year program. You're in GeroFit as long as you want to continue with the program and exercise. This program started in the Durham VA. It's actually coming up on its 40th year anniversary. And so really, really exciting. We have the program here in Atlanta, and we talked about, going to the doctor, maybe the doctor referring you to exercise, but not really being clear. So, a lot of times once you're done with a particular type of rehab, there's no place to go. And what happens is you're out of rehab, discharged, and you may have some decline, and then you're ultimately back in the hospital, maybe institutionalized. So what GeroFit was a program, or is a program, to step in and kind of limit that. And the data has been really quite astonishing. So the really positive thing about GeroFit, again, it's been around 40 years, but it's also tied to the veteran medical record. So there's really quite a lot of data on how this works. And so this is just one example. There are numerous publications that have come out over the 40 years, but this is looking at prescribed medication usage. So following 12 months of supervised exercise, you have 47% reduction in opioids, 36% reduction in mental health medications, 32% reduction in cardiovascular medications, 22% reduction in diabetes medications, 22% reduction in lipid lowering medications. And again, we talked about these things being tied to brain health as well. So it's not only are you taking older adults that were previously sedentary, but now they're be able to improve other aspects of their health such that they can reduce this medication usage. And all of this lower risk factors in these areas is also lower risk factors related to brain health problems. So really, really exciting program, and really excited that we get to be a part of it here in Atlanta. So, and then I only had 20 minutes, and we were going to have a discussion, so I want to be sure I left time for that. I do want to finish with thanking all of you, and certainly the organizers for the invitation. My colleagues, I listed some funding agencies there. I have a slide here at the end with my email address on it. Always happy to answer questions or tell you more about our research if that's something you want to hear more about. But I believe, Dr. Parker, I'll turn it over to you for questions.
Sure. Thank you, Dr. Nocera. That you actually answered quite a few of the questions that have come in, but I think a little bit more specificity wouldn't hurt. So you talked about 150 minutes a week and what's better based on your presentation, like the aerobic things, like the swimming, the cycling, were things that were better for overall improvement. But what other things can we do? There's a question from a person who has been sedentary, and I think that one of the things I liked about the GeroFit is it didn't really matter how old you were, things were improved. So for people who have COPD, I'm sure this person has been told that he can't exercise. COPD or chronic congestive heart failure, you can't exercise. What do you recommend for those people? We want to exercise, he wants to be healthy. I know as a primary care provider, you have to get some kind of clearance to be in organized programs, but what would you suggest for somebody with COPD or even CHF, congestive heart failure?
Yeah, and when we talk about these, specific conditions, a lot of it is going to depend on, sort of where you're at in the progression of that disease, and whether you're extremely far along where nearly everything is difficult, or whether you were just diagnosed and things you're just starting to notice. There's something that can be done for all of us. And the key is that it's identifying where you're at today and then progressing yourself into a better level of fitness throughout the coming weeks, months, and years, all with the idea of getting to a goal. And so, it really is going to depend on your functional status, your cardiovascular fitness level of where you can start. But no matter where that is, we can improve. If you are having a lot of difficulty, or even if not, and you're really completely unsure what to do, I think that's a time to get it, have some involvement of a exercise physiologist or a physical therapist, somebody that can kind of get you started on a program that's prescriptive based on your individual needs. But there's no time like now, the present. The 150 minutes is what the goal is for all of us. If you're not there, if you can't, walk up a single flight of stairs, or you can't walk for more than 5 minutes without having to sit down and take that's okay. We can start there. And, as exercise professionals that are really passionate about improving people's lives and health outcomes, that's fine. We'll start where your functional status is, and we'll come up with a program to build on that and improve you over the course of weeks and months and years. And the ultimate goal of all this is to change your lifestyle habits. And you want to have exercise and physical activity and healthy eating, good sleep, all these, you want to make these lifelong habits. So kind of a long answer, but hopefully that helped.
So on that note, though, you talked about getting your doctor to prescribe exercise. Okay, you're a kinesiologist. As a physician, and I see somebody's not physically fit or needs rehabilitation, I would write a prescription to physical therapy to see if we can strengthen somebody. Is that what you would advise people to ask for? By definition, you're a kinesiologist. How can I get to a kinesiologist? How can we do that?
Yeah, so I think having your primary care physician refer you to physical therapy is a great start, because they're sort of a gatekeeper into increasing physical activity and addressing individual needs. So physical therapy is a great place to start. If you are, okay, I know I need to exercise more. I don't necessarily need to see my doctor. I don't have anything that I'm worried about. You could go to your local gym. They typically have individuals that you can work with, sort of on a personal individual level. They usually always have group settings. There's a lot of resources online. There's a lot of programs that are particularly geared for individuals with chronic disease or mobility limitations. So it's really getting out there and listening. But if you're absolutely not sure where to start, your primary care physician is a great place. And through PT or through a trained rehab expert would be a really good way as well.
Okay, Cornelia did put in the chat, you stated that with the Exert study, a lot of that took place in the Y. So a couple of things that I can share about the YMCA. YMCA programs are covered by Silver Sneakers, which is covered by your insurance. So instead of paying out of pocket, your insurance will likely cover that Silver Sneakers program. But the YMCA also offers a exercise person who can kind of make a recommendation for an activity level for you. So you talked about aerobic exercise, but let's talk about strength training. I know with John, he does exercises in the chair, and when you do that chair exercise, you kind of get a little worn out sometimes. So talk to us about strength training and how important that is and what that actually is, because you don't have to be a wrestler or be a track star and bench press 100 pounds. What exactly is strength training, and how can we do that simply?
Yeah, so really great question, and so relevant to healthy aging. I think for a while it seemed like strength training was kind of forgotten about in terms of how important it was, and there was a big push of how important aerobic training was. So aerobics is where we're just getting our heart rate up and we're staying in a particular zone for 20 or 25 or 30 minutes. That typically is kind of the standard definition of aerobic training. Strength training is where we're targeting a large muscle mass. So it could be our chest, it could be our arms, it could be our legs. So you mentioned bench press, you mentioned bicep curls, lunges. And why this is so important is that our daily movement requires our muscles, these large muscle groups. We're talking about walking, getting up and out of a chair, reaching for something, lifting an object. All these require not only a strong heart for that cardiovascular aerobic fitness, but also our muscles to be healthy and functioning. There's a word called sarcopenia. This is what happens to muscles as they age. And strength training, so lifting weights, is a number one defense of sarcopenia, of limiting sarcopenia and muscle atrophy and wasting as we age. And the only way to do it is to exercise, strengthen those muscles through strength training. So you could lift weights, you could do with your lower extremity, body weight exercises can be enough. You think lunges or squats, I mentioned those, but it's really, really vital that in addition to getting on a treadmill or a Stairmaster and getting our heart rate up, that we target our muscles of both upper extremity and lower extremity to try to limit that sarcopenia that comes with aging. And there's a lot of, again, there's a lot of programs out there. Silver Sneakers, the folks at the Y are perfect resources for this, because they, if somebody comes to me and says, what kind of exercise should I do? I tell them the one you enjoy, but I would also make sure that I let them know that you're going to have to do more than just aerobics. It's aerobics, strength training, it's flexibility and range of motion and balance exercise. And anybody at the Y would tell you the same thing. They would never just say, okay, treadmill over there, 20 minutes, go. That's it. You're done for the day. You really have to do strength training as well. So Silver Sneakers, really, really excellent resource. YMCA, excellent resource.
So let me interrupt here just a second. There are a couple of suggestions in the chat. Ms. Toludo, Janice Toludo, has indicated that senior centers are a good place to look for exercise classes, and they're usually free. And she talks about what's available in Alpharetta: yoga, chair yoga, Tai Chi. And then Flora talks about senior fitness with Meredith. And our Marissa has said on YouTube, we have some low impact exercises that come through the cognitive empowerment program. But there's a question in here about weightlifting if you have a hip replacement. So can we talk about a different way to talk about weightlifting instead of like the barbells? What about, like what your body does? I'm trying to isometric. That's not what I'm trying to talk about, but like when you do the plank,
Mhm.
weightlifting versus other ways of doing muscle training other than weights as such.
Yeah, and when we talk about, again, a specific example of like a hip replacement, that's going to start very early on in the following surgery. You're going to be doing muscle activation exercises within 24 hours of your surgery, and that's just simply getting the muscle firing. And that's a really, really impactful, positive thing to do after a surgery. And then you're just going to progress up. The thing about it, whether you're talking about after surgery or not after surgery, it's all about that progression. So you don't have to necessarily, when we talk about leg exercises, you can do body weight exercises. You can do a wall sit, where I think what you were alluding to is how to work a muscle without moving a limb. You can do you can it is isometric actually. You can and have hold your leg up and hold it for 10 or 15 or 20 seconds. That's not necessarily contracting a muscle like going in the gym and having a bar on your shoulders and doing a squat. That's that's an activity where the muscle's firing, but it's not moving, and that's something you do very early on. You could do very early on after a surgery, like you mentioned. So there's so many different types and different ways to target these muscles, and it really it depends on an individual when it comes to post surgery or how far along they are post surgery. And so again, working with somebody that early on, a hip replacement is going to be PT, and then you can kind of graduate out into maybe a YMCA, and those individuals will assess and see where you're at, and then prescribe impactful necessary exercises.
And can you talk about the benefits of, let's say, water aerobics versus standing not in water? And I know in a lot of senior centers, they offer water aerobics classes. What's the advantage of a water aerobics class?
Excellent. It's a perfect example of how great things are and how great options are, but also the importance of doing other things. So here's why water aerobics are great. I can have you, I can really push the needle. Let's say I'm having you're in water that's just chest high, and I'm going to have you do a jog in place. So you're essentially running in place, but you're supported by the water. If I do that outside the water, your chances of fall is going to go significantly up. So I wouldn't be able to ask you to get your knees up as high as you can, as fast as you can, without really increasing the risk of a fall. There's other in the water as well. You can use the water itself as resistance. And people really oftentimes enjoy being in the pool. A day like today, I would much rather work out inside in the pool than I would at Stone Mountain. It's just so hot out. So there's it's just a different way to do things, but it is important to do things outside the water because it's really good for our bones as well as our muscles that we do weight bearing exercise, and the water takes away that weight bearing. So we do need to do walks through a mall. Since it's hot today, we'll go on a mall walk. But the water aerobics is just a perfect example of doing something different that can benefit you, and particularly if it's something you enjoy. So water aerobics a couple times a week, treadmill a couple times a week in the gym. All these are different examples. And I'm seeing some of the chats pop up and talking about these classes. Another really good thing about Silver Sneakers and the YMCA, in addition to the benefits of the exercise, that these are typically group settings, and we've found over the years that exercising in a group is really impactful and tends to lead to better adherence to the exercise. You kind of feel, you're part of the team, and you don't want to let one another down. You want to show up for the class, and it's an excellent way to meet people. So keep that in mind. That there's options online that you can do it in the comfort of your own home. But if you have the option to, in addition to that, potentially go out and interact and
A dance class, ballroom dance, that counts.
Work with a group. It's really better. That social networking aspect is really good.
So thank you so much, Dr. Nocera. And we have quite a few people on here listening, and it's really important to connect the two. And that's why we have John do his little bit of exercise in a chair, starting off almost all of our sessions. So thank you so much, Dr. Nocera. We're happy to have had you back on our program. We look forward to seeing you some more. And if there are any exercise programs that our audience can participate in, if you'd kindly send me who those people are, the names of those people we should contact. We want to make sure that if there are exercise programs and activities that our people can get involved in, we want to get them involved, because all of your stuff doesn't require that you be a veteran, right?
That's correct. We have studies outside the VA, as well as VA studies that you do not have to be a veteran. Correct. Thank you.
Okay. All right. Thank you, Dr. Nocera.
Thank you for having me. I really appreciate it.